Hello everyone. Today, we're going to explore the medication known as sodium polystyrene sulfonate, commonly marketed under the brand name Kayexalate. As with all our discussions, this presentation is for educational purposes. For health-related inquiries or issues, always consult a healthcare professional. Description: Sodium polystyrene sulfonate, or Kayexalate, is an oral or rectal medication that belongs to a class of drugs known as ion exchange resins. Its primary role is to treat hyperkalemia, which is an excessively high level of potassium in the blood. Kayexalate works by binding to potassium in the intestines so that it can be removed from the body through the feces. It's especially useful in patients with kidney disease who are at risk of hyperkalemia due to reduced kidney function. This medication can be administered either by mouth or through a rectal enema. Warnings: Kayexalate should be used with caution. It is not recommended for patients who do not have hyperkalemia. Additionally, it should not be used in people with obstructive bowel disease or in those who are at risk for bowel obstruction. Patients with hypokalemia, low potassium levels, or those who have a history of hypersensitivity to polystyrene sulfonate resins should also avoid using this medication. Before taking this medicine. Before starting treatment with sodium polystyrene sulfonate, it's crucial to inform your healthcare provider if you have any bowel-related issues, including constipation or inflammatory bowel disease, as this medication can cause gastrointestinal disturbances. If you are pregnant, planning to become pregnant, or breastfeeding, discuss the potential risks and benefits of this medication with your doctor. It's also important to tell your doctor about any other medications you are taking, as Kayexalate can interact with certain drugs, particularly those that are also retained in the intestine or those that affect electrolyte balance. Side effects: While effective, Kayexalate can cause side effects. Common issues include nausea, vomiting, and constipation. More serious side effects might include gastrointestinal problems such as bowel obstruction, ischemic colitis, and in rare cases, bowel perforation. Symptoms such as abdominal pain, bloating, or bloody stools require immediate medical attention. Additionally, Kayexalate may also cause electrolyte imbalances, such as low potassium levels, which need to be monitored regularly. Interactions: Sodium polystyrene sulfonate can interact with other medications, which can prevent them from working effectively. For example, it can bind with lithium and thyroxine, potentially reducing their effectiveness. Always discuss all your current medications with your healthcare provider to avoid adverse interactions. Dosage: The dosage of Kayexalate varies depending on the individual's potassium levels and overall health condition. Typically, the starting dose for adults is 15 grams, administered 1 to 4 times a day. The medication can be mixed with water or a small amount of syrup to improve palatability. Always follow your doctor's instructions carefully and do not adjust your dose without consulting them. Avoid: Patients taking Kayexalate should avoid becoming dehydrated, as dehydration can impact the effectiveness of the medication and worsen side effects. It's also advisable to monitor your dietary intake of potassium and consult a healthcare provider for a suitable diet plan that maintains potassium at safe levels. FAQ: A common question about Kayexalate is whether it can be used in children. The use of this medication in children should be closely monitored by a healthcare provider, as pediatric dosages differ from adult dosages and children are more sensitive to its effects. Closing. That concludes our discussion on sodium polystyrene sulfonate, or Kayexalate. Remember, this information is meant to educate and is not a substitute for professional medical advice. Always consult with a healthcare provider to address any concerns or questions you might have. Thank you for joining us.